ATI activity that is connected to this lecture, which is your skills module, personal hygiene. Okay, and I believe this is part of your graded assignment. Okay, that means you need to do this mandatory. Okay, so this would be your references, this would be your resources. Okay, on top of the book, you have your ATI skills module, personal hygiene. Make sure you complete the lesson in that one. That would be helpful as well. Okay. All right, who wants to volunteer for the objectives? I may need some volunteer to help me out, please. Anyone? You can read it aloud.
Discuss the therapeutic hospital room environment. Describe personal hygienic practices. Discuss variations of the bath procedure determined by a patient's condition and physician's orders. Describe the procedure for a bed bath. Identify nursing interventions for the preventions and treatment of a pressure ulcer/injury. Discuss heat and cold therapy and related procedures.
Okay, go for it, Didi. Thank you, Didi.
Objectives: describe the procedures for oral hygiene, shaving, hair care, nail care, and eye, ear, and nose care. Outline the procedure for a back rub. Summarize the procedure for perineal care for a male patient and a female patient. Discuss the procedures for skincare. Describe the procedure for making an unoccupied bed. Describe the procedure for making an occupied bed. Discuss assisting a patient in the use of the bedpan, the urinal, and the bedside commode.
So pretty much these are what you when you read the book, you will learn how to properly perform an unoccupied or occupied bed changes, right? Okay, but very important. What we want to learn, what we want you to learn here is there are some techniques, there are temperatures that we need to maintain. Okay, room temperature, the bath temperature, the water temperature, the sitz bath. Why do we perform the sitz bath in the first place? Right? Okay, so what is the reason why sitz bath is being provided for the patient? Okay, but very important in this chapter is, although it's a very short part in this book, okay, I want to focus on this area. Identify the nursing interventions for the prevention and treatment of a pressure ulcer injury. Okay, because in your daily practices as nurses, okay, this is one of the more common things that you would be encountering, not just the wound care, but also managing a patient who developed a pressure-related injury, okay? And this is one of the skills that I would really encourage you to be very, very good. So understanding how does a person, how does a patient develop a pressure-related injury, okay? What causes it, okay? And what can we do? And that's our job as nurses. Remember, you're dealing with two things, okay? You have the medical diagnosis of the doctor, okay? So the patient may have cancer, the patient may have some difficulty breathing or respiratory problem that's causing him to be bedbound. And one of the risks involved when someone becomes bedbound, meaning they're no longer able to move independently, okay, is the development of pressure ulcer. That's where you nurses would come in. Okay, so remember, when you deal with the medical diagnosis, you're dealing with what the doctor thinks is the problem, right? Okay, when we think about the nursing diagnosis, okay, we are focusing on the human response. Okay, so that's the main distinction between a medical diagnosis and a nursing diagnosis. And for nurses, we're pretty big in the nursing diagnosis, meaning we are going to deal with how these patients respond to their condition. Okay, if they have respiratory problems, okay, how does it show to them in terms of their maybe presentation, their clinical presentations, signs and symptoms that we're looking at, and then we go to the whole nursing process. We start with the assessment, the nursing diagnosis, and we make our plan, and then we make our interventions. What can we do this time? Okay, can we minimize the occurrence of a pressure-related injury if we follow repositioning the patient every 2 hours, right? So those are just simple things. Can we teach the patient how to properly perform deep breathing exercises, coughing exercises. Okay, is this something that would help them with their condition as well? That's where we come in as nurses. Okay, that's our focus of our learning. All right, some key terms that I want you to be very familiar as well would be some of this you may have taken this up in your anatomy and physiology. Where is your axilla? Where is your bed? What is a bedpan? Okay. Does anybody know where the canthus is? Where is the canthus? When you see the word canthus, what are you looking at?
Just in the ear, the eye.
The eyes, right? Okay. So you can have a medial aspect or the lateral aspects, meaning the middle part of the eye, that's the inner canthus, and this is the outer canthus, pretty much. So since we're doing bed care here, okay, when you clean the eyes of your patient, you want to start from the inner canthus, from the inner part, meaning toward from the ear, the nose part, outside. Okay, so you can go laterally. Okay, inner canthus to the outer canthus. What do you think is the reason for that?
Why wouldn't you do it the opposite way? Because isn't anything that comes out of your eye, doesn't it go towards the inner part, like through your nose? Like if something.
That's exactly why do we have to perform wiping? And that's a very good question, Amelia. Right? Okay. Why do we recommend cleaning from the inner canthus to the outer canthus? Let's go back to your ANP. Where is the canal in your eyes? Where does it drain?
In the duct in your inner corner?
Are your canals located here in the outer canthus, or does it drain medially towards your nose?
It drains towards your nose.
Towards your nose, right? So when you clean someone, when you're putting an ointment or when you're instilling a medication to the eye of the patient, okay, you want to stay away from that canal because otherwise, if there is a probability of infection, okay, you are going to increase the risk for infection in that patient. Okay, so when we clean it out, okay, we put it away, okay. Okay, so we try to deviate that direction. Same thing when you apply an ointment, it should be from the inner canthus outer. Okay, so that's the direction. So we're going to be learning about circumorbital, circumural, dentures. Okay, so circumorbital, what is that? From the word circum.
Isn't it like around the eye, like the
Around the eye. Okay, circumural. What when you hear the word circumural, what does it mean? That's around your lips, right? Okay. So when you see it, the doctor is saying, talking to you, and trust me, when doctor talks to you, they're gonna talk to you in clinical terms. When we talk to our patients, we talk to our patients in in simple languages, right? Circumural cyanosis, meaning what is cyanosis?
isn't it like when it's blue, like when your lips are blue?
You start to develop a bluish discoloration in the skin. So when you see the word circumural cyanosis, now you know that the lips of the patient are getting bluish. That could be a sign of hypoxia. Okay, so again, these terms are important. Okay, febrile. Everybody knows what febrile is. Febrile is the other term for fever. Okay, so the patient is in a febrile state, meaning the patient has an elevated temperature. Okay, labia, I'm pretty sure you took this up in your ANP, right? The minora, the majora. What is a medical asepsis? Can anybody tell me what is medical asepsis?
Cleanliness.
Is it a clean technique or a sterile technique?
Clean technique. Clean.
Okay. When I say surgical asepsis, is that sterile or clean technique?
Sterile.
That's sterile technique. Okay. Medical asepsis is a clean technique. Surgical asepsis is a sterile technique. So those are just terms that you can interchange, right? Pathogenic is something that can cause a disease. Okay. So when you have a pathogenic strain of bacteria, what it means is it can cause a problem to the patient. there are bacteria that are considered non-pathogenic, meaning you can inhale them. You're not gonna go sick. You're gonna be okay. It's not gonna bother you. Okay. You have bacteria inside your body, what we call as the resident bacteria, or the what we call as the normal flora in your gut, in your vagina. You have these bacteria, but they don't do anything. They don't do any harm to you. Okay. For the most part, for as long as they stay within their normal flora, okay, they're considered as non-pathogenic, meaning it's not going to cause a disease or an illness. Okay. Once it travels, and this is again important, especially for women, wiping your patient front to back, right? Okay. So meaning from the front towards the anus area, towards your number two, has some clinical significance, right? Because if this bacteria that's residing in your anus, in your number two, if you wipe yourselves, especially for females, in the wrong way, okay, and it goes to your urethral canal, you may develop infection. Okay, and remember, the female canal is only about 2 to 3 inches. It's very short. Okay, that's why women are so prone in developing urinary tract infections. Okay, it's a shorter canal. Plus, if some of these bacteria migrate, then they become pathogenic to you. Those are not residents in your vaginal area, meaning it can cause harm. It can travel into the urethral canal. It can infect your bladder. It can even go up and infect your kidneys. That's what we call as an ascending type of infection. Okay, so these are the things that you need to learn. What ways can I prevent the possibility of infection, especially if I'm dealing with a female patient, right? So we perform this perineal care, okay, and then we learn what would be a good personal hygiene, not just for the patients, but for you as nurses as well, future nurses. Okay, range of motion exercises. Okay, everybody took this up in your previous lectures, right? Okay, so you will be tested in this one as well. Okay, so you need to know the different ranges of exercises. When I say an active range of motion exercise, what does that mean? Let's do a quick review.
It means that the patient is doing it themselves.
If I say a passive range of motion,
That means that you're like helping the patient do it, like you're moving their arms and stuff
if
forward.
it's a passive assisted,
Oh, it means you're working together.
or if it's an active assisted, what does it mean? Okay, if I am the patient, I'm doing this myself. What do you call this range of motion? I'm doing it myself. I'm your patient.
Then it's active.
If you are the nurse and you're helping me move these arms, what do we call this? If I am the patient, I have a stroke, I'm weak on my left side, okay? I'm strong on my right side. Now I'm going to perform an exercise on my weaker arm using my stronger arm. What do we call this range of motion exercise now? Now I am assisting my own arm, my own weak arm, okay?
Active assisted.
And the second thing I have.
So make sure you know those distinctions. You will be tested in those terms as well, okay? Sims position. Everybody knows what is Sims. What is a Sims position?
Laying on the side with the thigh flex.
Okay. Supine. If I tell you put your patient in a supine position, what does it mean?
Is it when you're putting them on their chest?
We're gonna put them on their back, flat, right, with no elevation on the head of the bed. Okay. We can modify the supine position by putting them in what we call a semi-Fowler's or a Fowler's position or high Fowler's. Okay. So now let's see again the differences between what is a semi-Fowler. How many degrees head of the bed elevation should you do?
30 to 45.
If I have a high Fowler's,
60.
Just one.
60 to 90.
so it's about 90. Okay, high Fowler's is 90. 45 to 60 is Fowler's. Semi-Fowler's is 30. Low Fowler's is 15. Okay, so and these are important. For people who are receiving nasogastric intubation, if they are on peg tube, okay, they're being fed through their nose or through their mouth or through their gut, okay, nothing oral, okay, they're using tubes. The minimum position that you can put them is, in some books they would say 15, and most of the books would say put them on a semi-fowler, which is 30 degrees head of the bed elevation. Okay, so these are all the clinical importance of those positionings. Okay, if you are doing an oral care, since we are in hygiene, okay, for someone who is comatose, what would be the best position for this patient? Oral care.
High Fowlers.
That would minimize the risk of aspiration for them. So if you're cleaning their mouth, they're unresponsive, okay, in which position would you put these patients? You want to put them on a Sims position, okay? You can put them on a left Sims position, and this is important. This always comes out in most NCLEX questions, okay? A comatose patient or an unresponsive patient, we put them on a left side position, meaning left Sims position doing oral care, okay? And that would minimize, that means by gravity, okay, you're pretty much draining the fluid out into their mouth using this position. That would minimize risk for aspiration, okay? Syncope, what is syncope?
Fainting.
Syncope is a fainting, okay? A temporary loss of consciousness. Let me just put this. All right. So umbilicus, everybody knows where your umbilical cord is. Urinal, vasoconstriction, vasodilation. This has something to do with the heat and cold application. And vertigo, what is vertigo?
The dizziness.
Dizziness. Okay. All right. Pretty good. You're doing well. All right. Let's define hygiene. Okay. So this is the science of health. This meaning there are evidence-based practices when it comes to hygiene. Okay, so when you take care of your skin, your hair, your hands, pretty much your body in general, okay, you are performing your own personal hygiene. Okay, so the self-care measures people use to maintain their health. Okay, everybody wants to look good, everybody wants to smell good, right? Okay, that is your personal hygiene. Okay, and one of the things why we want to maintain hygiene on our patients, okay, not just to ourselves, because it promotes medical asepsis or clean technique, which prevent or inhibit the growth and spread of pathogen. A simple hand washing is part of that hygienic practices. This is a basic practice for among the nurses. Okay, your hand hygiene. All right. Factors that influence a patient's personal hygiene. Okay. How does your body image affect them? Okay. Volunteer, please.
When you look good, you
Go
feel,
for it.
feel good.
Darcy, go for it, Darcy.
When you look good, you feel good. It makes you feel better about yourself.
Mm-hmm. That is your subjective concept of your own physical appearance, right? And that's very true. If you look good, you feel good, right? If you smell good, you feel good, right? People around you feels good as well. Okay? Can you imagine if you don't shower for 3 days, you go to your clinical and you start to stink, and you right? Okay? How do you think the people around you would feel, right? So body image is important. That's an important factor. Another factor would be cultural variables. How does it play when it comes to someone else's personal hygiene?
Your background
And what does it do?
is the cultural background.
Okay? There are cultures that would require daily bath, like the Indians, right? Okay, the Hindus. Okay, in their practice, okay, it is important for them because it's part of their cleansing process. It's very important for them to shower every day. Okay, so that means again, becoming a more culturally sensitive nurse. If I'm dealing with a Hindu patient, okay, then that means I have to make sure that part of my care plan would be a daily shower for this patient, right? Because I'm trying to consider the cultural influence of that patient. Okay, there are cultures who would love to shower every day. There are in certain European cultures, okay, like the French, okay, uh, they don't shower every day. Maybe once a week is okay. They wash their hair, okay, and they're good. Okay. So again, there are some influence on how people take care of themselves. What about knowledge?
Self care.
Yep, knowledge about self-care. Yes. What else?
I guess knowledge of their like mental health and stuff. Because I know sometimes when people get like depression and stuff, they stop taking showers and stuff.
They start to forget about their own personal hygiene, right? When they become depressed. Now let's put it in another perspective. If you're dealing with a patient who is diabetic, what would be a good in terms of knowledge? What would be a good education for this patient? Where would they focus? Where would you focus your patient who are diabetic?
Feet care.
Foot care. Excellent. Good answer. Okay.
Maybe shaving as well.
The use of the proper like shaving can can we elaborate on that one? That one's a very nice one too. What would you recommend in terms
Just
of shaving for diabetic patients?
be really careful to use the right razor to not nick their skin or break the skin barrier.
Because it can lead to poor healing, infection, and a lot of complications. And that means they cannot use a bladed shaver. You're going to use an electric razor. Okay? So very important to remember. For diabetics, you want to recommend the use of an electric razor. Okay? What about the physical condition?
I guess sometimes I know that like people with obesity sometimes they struggle with personal hygiene because like they have struggle with getting up in the morning and stuff. And so like sometimes like parts of their body, like if they have like a layer of fat that's like over their stomach or something and they can't reach it, then that can like lead to open sores and stuff.
And there are conditions where it would be difficult for them to be performing these tasks, right? So people with COPD, chronic obstructive pulmonary diseases, they have breathing problems. Okay, maybe the simple action of just combing the hair can leave them breathless or short of breath. Okay, and this can affect how they would maintain their personal hygiene again. So now, if we're able to identify these patients, okay, I have this patient who might need full assist in terms of the daily hygiene care. Okay, then I'm gonna include it in my care plan, and probably I'm gonna assign my CNAs. Okay, make sure this patient receives full support. Okay, so that means we are able to identify the needs of the patient. Social practice is very similar to a cultural variability, right? And of course, the socioeconomic status. Does it really have an influence on how you take care of yourself, whether you have money or not?
Yeah,
Yes.
like what your priorities are.
Heck yeah. No, not only that, it's what you buy, what what you
What you
purchase
can
to make
afford.
yourself look good, what you can afford.
Very good, very good. And pretty much, and again, going back to that point, okay, if I'm gonna buy this brand, okay, or maybe this brand which is a lesser cost, I can bring more food to the table, right? Okay, so these are the variables that we want to consider as well, and these are the things that would influence. Okay, so very good responses, right? So let's look at some of these. I want you to follow me if you were able to download the slide. Okay, let's focus, and there's a lot of information here, but I'll help you out where to focus for your NCLEX and for your quiz. Okay, so in terms of personal hygiene, okay, this will vary culture to culture. Okay, in the case of Chinese Americans, okay, they view personal hygiene as task associated with closeness and touch as offensive. Okay, so that means if you're dealing with a Chinese American patient, okay, we need to be very careful before we touch them. Okay, so giving them information. Okay, I need to move you, and I will be touching your shoulders, or I'm going to be touching your leg area. Right? We talk to them in simple terms. Right? So giving them a good enough warning. Okay, might minimize. Okay, because for them being touched by someone that they don't know, that they're not close with, can be offensive in this culture. Okay? For Vietnamese Americans, they are likely to feel very uneasy during a back rub. Okay? Ask patients what makes them most comfortable during a bath. Okay? So So when you start grabbing them their back, okay, that might be something that might people, patients of this culture might take offense. Okay. Now, just like what I mentioned earlier, the East Indian Hindus, okay, consider personal hygiene to be extremely important. Okay, that means when you're dealing with this culture, okay, part of the care plan would be a daily bath for this patient. And we know for those, how many of you have worked as CNAs or worked in CNAs? How often do you guys provide shower on your patients on a weekly basis?
2 times a week.
3 times a week?
It depends on how many patients you have. You know, if you've care planned it out, it's usually care plan. Well, it used to be care planned to twice a week, but we had a lot of patients back then.
Have you ever encountered
They schedule.
have you ever encountered, like in this case where we're talking about the Indian, the Hindus, okay? Have you encountered a care plan in your facility where, okay, there's a modification, we need to provide daily shower for this patient because of cultural consideration? Have you had those patients? Have you ever had those patients? Okay, and this is one of them. Okay, so that means when you become nurses, when you create a care plan, okay, knowing the cultural background of your patient would help you come up with a good care plan. Okay, I have an East Indian Hindu here. Okay, part of my care plan is a daily shower for them because this is very important for them. Okay, so temperature. Okay, a bath that is too hot has the potential to injure the eyes. That's what they believe. Okay, and again, very important again, this might come up in the test. Hot water may be added to cold water, but cold water is not to be added to hot water. This is part of the ritual. Okay, in real life setting, we don't practice this. Okay, why? We have two types of faucets, right? Hot and cold water. Okay, but can we make this modification? Sure. If we're gonna put it in a container, maybe on a bathtub, okay, then maybe we can start with a cold water and then add hot water, right? Okay, so in concept, because culturally, again, back in their country, maybe they're using certain types of pail, perhaps to do shower, okay, and this is how they would mix cold and hot water, okay. So always part of your assessment is, okay, this would be part of the questionnaire that you would be asking on the assessment process when you're doing the care plan for the patient. There is what we call as an early morning care. What is usually involved, CNAs? Let me have I ask your answers for this. What do you guys perform on an early morning care?
Oral care.
So AM care. How would you refer this usually, and how would you different this from your morning care or after breakfast care? After breakfast, what do you guys usually do?
Oral care.
Bedpan.
Bedpan. Very good. Okay. This is
Sure.
also the time where you would provide them showers. Okay. Nail care, hair care, oral care, usually done after breakfast. Early morning care, what do we do? You usually want to prepare them for breakfast, right? So what is usually being performed in an early morning care?
You get them
Oral care.
dressed. You get them dressed and ready for breakfast.
Hmm.
You brush their hair so they're presentable, and their teeth.
And then routinely in the afternoon, what do you guys do in the afternoon care?
Put them down for a nap.
Okay. What else?
I mean, back in the day, that's what you did because they were exhausted by 2 o'clock in the afternoon, you know, and they wanted to go watch TV and lay down.
Keep in mind, okay, so between the after breakfast care and the afternoon care, between those periods, what activities do you think are they doing? They're going into their exercises, they're going into their PT appointments, right?
Right.
Okay. They go to their daily activities. So what can you offer in the afternoon care for the patient?
Washing the hands.
Washing the hands, washing the face, okay, and maybe another set of oral care for them. Or if they are pretty much dependent, maybe offer them a bedpan, right? And then the last part would be the evening care or hour before sleep. Okay, this is again another important component when you perform hygiene care for your patient. Okay, then what do we do here now on the